This is a recording of upper GI bleeding for Simman case. The task says that there is a man who is aged up to 60 years old. He was brought to the hospital by his wife because he's fainting and he has dizziness. Talk to the patient and you will find nurse colleague with the patient inside the cubicle. Okay. So when you ask the patient at the beginning, you will greet yourself and look at the monitor, look at the patient. Talk to the patient. The patient is talkative and quite conscious here in this case. So you will ask the patient simply first, how can I help you? Doctor, I'm feeling dizzy and I am about to faint. Okay, first question you'll ask him, what do you mean by dizzy? He will tell you, doctor, actually I feel like I'm about to fall, but I don't. Ask him, when did it start, how did it start, and brief elaboration of the dizziness. He will tell you that the dizziness started like maybe yesterday and it's getting worse since yesterday. It started all of a sudden and it has been continuous and nothing changed it at all. And when he stands up, it gets worse and nothing makes it better. So this is for the dizziness. What about the fainting? He tells you that I'm feeling weak when I'm trying to stand up. This means that probably this patient has problem when standing up. So this means that this patient has problem with the blood pressure. Okay. He will tell you that this fainting or this feeling of fainting started together with the dizziness, and it started suddenly, and nothing changed it. Okay. Do you have anything else? He might tell you that he's having also shortness of breath. And this shortness of breath started together with the dizziness and fainting, and it has been continuous and it didn't change at all. And he's also feeling weak. So all these findings point you toward anemia. Anemia which could be due to many reasons. What is the acute anemia? Acute anemia which started yesterday or 2 days ago is most probably because of internal bleeding. Okay, we will get to know right now. So do you have anything else apart from that, apart from shortness of breath and tiredness and weakness plus dizziness and fainting? No, doctor. No, I don't have anything else. By any chance, any tummy pain? He will tell you no. Any heartburn? No. Any loss of appetite? No. Did you have any bleeding anywhere in your body? Well, sometimes he tells you yes, doctor, and sometimes he says no. Why I'm asking him about bleeding? Because now I know that acute anemia could be caused by bleeding. So if he says no, I will tell you in a while what will happen. But if he says yes, he will tell you, doctor, I'm passing black stool since 2 days, and it has been the same. Okay. So if he if he says yes. So if he says yes and told you about the black stool, this means that now you know that this is melena due to upper GI bleeding. Okay, or melena due to GI bleeding generally. But if he tells no, after a while he will tell you, doctor, actually, I don't know what happened. I'm feeling unwell. I'm so embarrassed. I passed dark stool, and this is second time. Yesterday it happened to me as well. And you will find your nurse colleague saying, I will take care of that, don't worry. And she will show you a nappy from behind the Simman, and it will be showing a black colored stool. Okay, so now in either cases, you know that this patient is having GI bleeding, melena. Okay, move to the past medical history. He will give you a history of osteoarthritis for which since long time for which he is receiving ibuprofen, but he started taking ibuprofen more frequently these days because the pain was not well controlled. Ask him about any other symptoms like any bleeding problem, any kidney problem, any liver problem. No, nothing else is significant or conclusive, and the patient used to smoke but he stopped, and he doesn't drink alcohol, and he follows healthy balanced diet. At any point while you are taking history, the vitals may drop. If the vitals drop, you already knew that this patient is having hypotension, most probably due to GI bleeding. And here, after osteoarthritis, you will get to know that it is due to probably peptic ulcer or due to upper GI bleeding generally. So move to the monitor, you'll address it as A, B, C, D, E, as we agreed before. You'll find the oxygen quite normal, but most probably you have to say that my patient is speaking, so the airway is patent and the oxygen is normal, quite normal, so you need to listen to the chest even here. But the problem is that the blood pressure is low. If the blood pressure is quite low here or is deteriorating, this means that the patient is bleeding. So I need to follow the hypovolemic shock protocol. I will ask my nurse colleague to attach 2 wide bore cannulas to my patient. Which cannula, doctor? Orange. And if orange is not present, gray. And from one cannula, take some samples like full blood count, LFTs and KFTs too, and blood group and cross matching for units of blood. And to the other side, attach 1 liter of pre-warmed Hartmann solution over 15 minutes. Okay, the blood pressure is improving right now. If it's not or if it's still not normal, you can attach another 1 liter to the other side too. Okay, what's your next step, doctor? The next step is that here the blood pressure is the only problem, so I may need to examine the tummy. I will expose the patient and ensure privacy and chaperone. Do just superficial palpation. You may or may not get any tenderness here. Okay, we need also to do some investigations. Which investigations? We have done them by taking the blood sample. I mean, all the investigations will be full blood count, LFTs and KFTs, and full and blood grouping and cross matching for units of blood. Okay, what's the next step? I corrected the blood pressure, so now I need to correct the coagulopathy, like any hypovolemic shock. For the coagulopathy, we give fresh frozen plasma with or without vitamin K. And if the bleeding or if the blood pressure didn't improve or deteriorate, I may consider giving blood transfusion to my patient. And later on, I will inform my senior and the medical team, and we will move the patient to endoscopy. So now I did the initial management, which is the ABCD. After the ABCD and correcting the coagulopathy and blood transfusion, I will do the definitive management by calling my senior and arranging the patient for endoscopy. Why? The patient will ask you, doctor, why endoscopy, doctor? Okay, because you're having a condition called acute upper GI bleed. You had this because probably you have been taking painkiller for long, and such painkiller may cause ulcer and bleeding in the lining of the stomach, and that's why you had this. Doctor, but I don't want to stay at hospital. Ask him why. He will tell you any reason. For example, I need to take care of my children. Tell him that we can arrange a carer for them. However, we need you to stay in hospital because we need to perform endoscopy through which we can find the cause of bleeding and even treat it too. If he still insists, you can talk to him about the complications and he will continue bleeding, and this may have fatal complications. And he will accept staying in hospital, and you will tell him about the endoscopy, and that's it. So this is the station so far, and it's mostly history-based station.